Hi, I'm Dr. David Roth. I'm here today to share with you something that I've developed for other practitioners to assist in the transition of their practices from regular office-based care to the telemedicine venue. So the purpose of this rapid conversion kit is to distill some of the experience we've gained over the last 10 years of doing telemedicine and teaching it to other professionals. The 3-page kit includes 3 distinct portions. The first portion is directed towards providers to ensure that they understand that there are differences that need to be adjusted for in this venue so that you can be as successful at providing mental health care or physical health care in the telemedicine venue as you have traditionally. So the list of suggestions includes things that are to do and not to do in order to improve your effectiveness as a telemedicine provider. The second page is primarily for your patients to help them either in the clinic receive instructions or through a modification of an email receive your new procedures for how they will visit you online, how they will obtain the software, set it up, and then properly engage you in it. The third page are suggestions specifically for your patients so that they can set up their own telemedicine venue properly in their home so that their interaction with you feels authentic and it upholds the principles we feel are important, such as safety, privacy, and the appropriateness of the venue. When these suggestions are incorporated into telemedicine, the experience can be excellent for both patients and providers. So we hope you enjoy this resource. If you need additional information, please visit our website, and we look forward to helping you out soon. Aloha.